The next COVID-19 wave could hit Singapore as early as July or August, and the entire healthcare system must be ready to handle these patients. At his ministry's workplan seminar, Health Minister Ong Ye Kung outlined the steps that Singapore must take to prepare for it. Sherlyn Sia with more.
Overwhelmed hospitals, care facilities and clinics is a situation that must be avoided, especially with the next COVID wave possibly arriving in a matter of months. Singapore's first 3 cases of the Omicron BA4 and 5 subvariants were reported in mid-May.
Every healthcare setting need to be COVID ready, need to be able to handle your own infections, take care of them in situ. In case pressure start to build up in our hospitals again, we got to find more beds to relieve the hospitals. Where can the beds come from? Home care services. Where the home bed become like a hospital ward bed. That's one. Number 2, nursing homes. Our hospital still houses many long-term stayers who are actually waiting for their nursing home place. So if we can ramp up our nursing homes to be able to absorb and take in these patients, it will relieve our hospitals.
As for community treatment facilities, Mr. Ong says that while they were designed to take in COVID cases, they need to be adapted to take in any patients who don't require acute hospital care. Moving ahead, he also announced Singapore's move to reduce the number of people dying in hospital instead of at home or in palliative settings. A study has shown that more than 3/4 of Singaporeans prefer to be cared for at home, yet only slightly more than a quarter actually do so.
There are sometimes challenging discharge process and protocols. Hospitals know that I can discharge this patient to palliative care or to the home. But sometimes the palliative care centre is not ready. Lack of equipment, not enough beds, for example.
That's why the ministry will work on 4 key measures. It's scaling up palliative care capabilities, smoothening discharge from hospitals, raising awareness of end-of-life care, and having better support for caregivers at home. MOH aims to lower the number of deaths in hospital premises by 10% within the next 5 years. But even before that, the aim is to keep Singaporeans healthy and out of hospital for as long as possible. MOH aims to roll out the Healthier SG enrolment program by the middle of next year, where residents aged 40 and above enroll with a GP and get a care plan. That includes regular check-ins even when well and recommended lifestyle changes. MOH will also increase the number of elder care centres from around 120 to 220 in 2 years and offer more health screenings and wellness activities.